In this episode of Kids Do Weird Things, let's talk about toxic synovitis and how it sounds really bad, but you'd actually rather have that than a septic joint. A kiddo that is limping or will not bear weight on their leg and they haven't had like a very obvious recent injury, that's something that needs to be worked out because that's something that's concerning. Probably one of the more common things is called toxic synovitis, which we changed the name to transient synovitis because toxic synovitis sounds really bad. Transient synovitis is an inflammatory reaction of that joint, most commonly the hip, but it can also happen in other joints. And because there's inflammation, it brings some fluid into the joint, and kids generally don't want to walk because it hurts, but usually they should be able to bear some weight. Transient synovitis usually happens in the vicinity of a viral infection. So they've been sick recently, but usually the fever has gone down and they're starting to feel a little bit better. Now, the one that we have to watch out for that's an actual emergency is a septic joint, which means there is a bacterial infection on the inside, and it is an emergency that we get that bacterial infection washed out to prevent degradation and damage to that joint. A septic joint hurts, so kids generally don't want to move that joint. They generally don't want to bear weight on that joint. They often have a fever. That skin overlying it is usually red, irritated, swollen, and a lot of times when we check their blood work, it shows evidence of inflammation or a high white count. A septic joint is a stat called orthopedics and usually going to the operating room to wash the infection out of that joint and get started on some antibiotics. Transient synovitis, since there's no infection on the inside of the joint, they're going to get better on their own. We usually do ibuprofen to help with that inflammation, and then activity is tolerated and follow up with the orthopedic doctors if they're not improving. There are a lot of medical conditions that can cause joint pain and limping in kids, but these do deserve a workup. If there's redness, swelling, fever, not bearing weight at all, we're concerned for a septic joint. It's time to head to the emergency department.